Hola, muy buenos días a todos. Gracias por acompañarnos en esta sesión informativa semanal de la OPS sobre la pandemia por COVID-19 en la región de las Américas. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y la sesión de hoy durará entre 45 minutos y una hora.
Be between 45 minutes and an hour long, and we will be accepting questions up to the very end. Please remember that you can find updated information on the pandemic on PAHO's website, as well as the latest cases and also the follow-up in the cases in the region, countries in the region, and material. We do have simultaneous interpretation into English and into Spanish, and you can listen to it by pressing on the interpretation button. We have already received questions via email, and you can use the chat to send us your questions through the Q&A button. And please identify yourselves using your name and media outlet. Today, Dr. Carissa Etienne, Director of PAHO, will be reporting to you about the current situation of the pandemic in the region, as well as the lessons learned over the last 6 months after the emergence of COVID-19. We have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Health Emergencies Department Director, Marcos Espinal, Director of Communicable Diseases with PAHO, and Dr. Sylvain Aldiguieri, Deputy Director for Emergencies and also Manager of COVID incidents. So now I would like to give the floor to Dr. Etienne. Dr. Etienne, please, you have the floor.
Good morning, and thank you for joining today's briefing. This past week marked 6 months since the World Health Organization was alerted about cases of pneumonia of unknown cause circulating in Wuhan. On January 16th, PAHO became the first regional office to issue an epidemiological alert with recommendations to prevent and control infections. Despite early warnings and swift preparations, no one could have predicted that our world would change so dramatically in just half a year. Indeed, as of yesterday, we have reached 5.9 million cases and almost 267,000 deaths in the Americas. Last week, there were 735,000 new cases in the region, with an average of over 100,000 cases reported every day, nearly 20% higher than the previous week. We are also seeing some new patterns emerge. 2 months ago, the United States accounted for 75% of the COVID cases in our region. This past week, the US reported just under half of cases in the region, while Latin America and the Caribbean registered more than 50% of cases, and Brazil alone reported around a quarter of those. We should all remain alert, but especially in places that have seen a recent acceleration of cases, as we're seeing in several US states, most of Central America, and most countries in South America. This is a pandemic of staggering proportions, and we have no option but to continue to put all our energy into controlling it. The past 6 months have brought some positive surprises that have confirmed the resilience of our health systems and some unexpected challenges that we must address in the ensuing months. PAHO and our member states leveraged decades of experience fighting outbreaks to confront the threat of COVID-19. And throughout the region, we saw countries responding swiftly. And here are some examples. We were impressed by rapid adoption of preventive measures. From the very beginning, people across the region quickly embraced public health guidance to stay at home, to avoid mass gatherings, and to use protective equipment. By late January, all but 2 of our member states had significantly limited international travel. And by early March, all but one had imposed movement restrictions to control the virus. And many of them did so even before they registered their first case of the coronavirus. This unprecedented effort was instrumental in keeping cases low early in the pandemic, thus earning us precious time to prepare our health systems. Emergency facilities were set up quickly. Across the Americas, temporary hospitals and designated isolation and quarantine sites were built in record time. At least 27 countries have activated emergency teams and established measures to strengthen their national health systems. These efforts provided much needed surge capacity for our health systems as COVID-19 cases started to rise. Thanks to these actions, we have saved thousands of lives. Many countries changed their systems to improve virus detection. COVID-19 challenged countries to decentralize their laboratory capacity, so they had the ability to quickly identify, report, and treat cases at the local level. Doing so required robust virtual and in-person training to prepare the laboratories and also to ensure required supplies, which PAHO helped secure and distribute, including some nearly 15 million COVID-19 PCR tests. But there are several persistent challenges which we must address to control the pandemic. Our health workers are vulnerable. Throughout the region, we have received reports of health workers becoming ill in the line of duty because of lack of personal protective equipment or due to unsafe working conditions. Protecting nurses, doctors, and other health workers should be our top priority. PAHO has provided guidance, training, and PPEs, and we continue to support countries to create better working conditions for frontline workers. Stigma fuels the pandemic. Stigma with COVID-19 slows down our response. We need people to feel safe and comfortable to speak up and to seek help when they have symptoms, so that we are better able to trace contacts and isolate suspects early on. This is our best hope for controlling the pandemic. Indeed, we still have a lot to learn about this virus. We have a number of public health measures that work to control transmission, and we must rely on them. Yet, every day, we learn more about how this virus spreads in our communities, and this science must continue to guide our response. Our teams at PAHO and WHO closely track new evidence and translate it into country guidance documents. Thus far, we have issued some more than 100 guidance documents. But not everything about the pandemic has been surprising. As expected, some of our region's most persistent problems have contributed to the scale of COVID-19. These are inequality, political division, and health systems that have been weakened by years of underinvestment. These are issues which we must address during the pandemic and continue to tackle once it is over. As we look to the future, everyone is affected and everyone has a role to play. From our team at PAHO to the leadership of our member states, but I dare say each one of us as individuals. A pandemic requires strong coordination across countries, a deep understanding of epidemiological trends, clear guidance, and a reliable supply of health products. These are all things that PAHO is actively doing to strengthen the response of our member states. Leaders across our region must let evidence guide their actions, focusing on what works and uniting their people around it. They have a responsibility to act transparently and proactively as they mobilize institutions in each country to respond. And each of us has a personal responsibility to protect ourselves and others through social distancing and by wearing masks. Even people without symptoms can transmit the virus, which means that everyone should be cautious. It also means that everyone can help us overcome this crisis. The past 6 months have shaken our world. The next 6 months will not be easier, and we cannot let our guard down. To endure, we must rely on our growing knowledge of this virus, our ability to apply these learnings in solidarity, and our unwavering resolve. Thus, we will face this pandemic. Thank you.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Let me remind you that we are going to have first questions that we have received over email, and then we will be using the chat to read your questions. You can push Q&A and then write if you have any questions or if you'd like to ask a question live. And as usual, please state your name as well as the media outlet. First, we are going to read the email that we have received, and we have questions. The first one says,
early on are now seeing a very large number of new infections over the past few weeks. Is PAHO concerned with a second wave of the pandemic in the region? Dr. Etienne?
Thank you for this question. What we are seeing now is not a second wave. This is still the first wave, and I'm afraid it continues to grow. This wave is moving within each country, affecting areas that have not had many cases before. And this trend is concerning. It's concerning for two reasons. First, the surge comes at a time when most people are experiencing a level of fatigue about the recommended preventive measures. And this ends up putting all of these people at greater risk. It seems obvious, but we should reinforce preventive measures when cases rise in a given city or state, and we shouldn't be relaxing them. The second reason for concern is that the pandemic is moving from some of the bigger cities that tend to have better hospital capacity to smaller towns that may not be able to accommodate patients that require ICU or other specialized care. Therefore, mortality could rise if more of the newly infected patients have trouble accessing the care that they need. Our region reported more than 22,000 deaths just last week. So that's 9% more than in the previous week. And we know that places with limited hospital capacity tend to have higher deaths. So yes, we are still in the first wave, not yet the second.
Gracias, doctora Etienne. La siguiente pregunta nos llegó.
Thank you very much, Dr. Etienne. We have now a question from El Mercurio, Chile, Nicolás Lujo. The question is, could you please give us some examples as to how the pandemic can be addressed in coordination among the countries, and do the differences among the strategies reveal any lack of coordination among the countries? Could PAHO lead to an alignment of the various strategies throughout the territories? Dr. Espinal, could you please address this question? Yes, thank you very much for the question. The Americas have a very long history of cooperation among the countries. We should not forget the famous Pan-Americanism that dates back to the days of our independence. The countries of the Americas are well known for helping each other. Clearly, the priority should be the people of the countries, and within the countries, they first need to take care of their own population and then cooperate across the border. But we have very pragmatic examples. Let me give you one. For example, PAHO has published up to July 6th, 92 technical guidance. And you can find those guides on our website that have been sent to the countries, and we have also implemented trainings. Today, more than 100 virtual training sessions and webinars have already been conducted with the participation of the staff from the various countries in the region. We have distributed more than 5 million tests to more than 35 countries, but this is just an overview. PAHO will continue to work with the countries, but we do have experience with countries, for example, in the Caribbean. These are small countries, and we have seen how Barbados and Antigua and Barbuda have cooperated to exchange lab information. We have also seen in the safety and security area how airplanes are used to carry different devices and safety equipment that need to land in various airports to continue to distribute these devices and supplies. So countries are different, and we cannot generalize. The guidelines as published by WHO are generic, and we work with the countries so that those guidelines can be adapted to each of the countries. There is no single method that can be applied to all of the countries, but our agency continues to work, our organization continues to work with all of the countries. Thank you very much. The next question is by Miguel Ángel Castro Jiménez from Noticias Colombia. He is saying that we have seen several government positions in connection with the importance of the pandemic, and at the beginning there was a denial of its existence. And has PAHO been able to identify difficulties in any country to perform their work or also to present their recommendations? Dr. Barbosa.
Gracias.
Thank you.
Gracias por la pregunta.
Thank you very much for the question. PAHO's role is to provide technical assistance to the countries by relying on the best evidence we have, so that each government can make their own decision based on their capacity and the situation in their own country. We continue to provide technical assistance to all of the countries, and we believe that over the last 6 months, we have learned a great deal, as the director just indicated. Some individuals may believe that this pandemic is not as severe as it is. The number of deaths and also the impact it has, not only on health, but also on the economy and on societies, is very important. We know that for a country to have good coordination in their response, it is also important to have a clear message and just one message to the population. These are very difficult times for the population to observe social distancing and also to follow all of the recommendations. We do need one clear evidence-based message, which becomes key to have a successful response. Thank you very much. Now, we have a question by Sasha Libon from Our News social media in Bahamas, and it reads,
to reopen to international borders, particularly to the United States, especially for a country like the Bahamas, where tourism is the #1 industry and represents 55% of the GDP? Doctor Ugarte, ¿podría tomar esta pregunta?
Thank you so much, Sasha, for this important question. Resuming non-essential international travel or tourism is a difficult call for any country, and especially for those with economies highly dependent on tourism like the Bahamas. It is not possible to resume the influx of international tourists with zero risk of COVID-19 cases. Therefore, any decision by national authorities in that effect should be informed by their capacity to monitor the health of the travelers once they arrive to the country as part of the pandemic response. At present, because of the experience at the beginning of the pandemic regarding the reduction of risk and transmission aboard of cruise ships, and because those measures are not yet finalized in terms of reducing the risk, resuming cruise liners traffic may be more challenging than air traffic. So why? Because the highest risk of importation is associated with countries of origin with community transmission. So in the case of the Bahamas, it will be highly important to have an appraisal of the robustness, of the strength of the health system in the Bahamas, particularly in those areas to respond to imported cases and also on potential subsequent local transmission, contact tracing, isolation, quarantine, and treatment of the persons. So this is a very important decision to take, but based on the assessment of their own capacity to deal with those. Over, thank you.
Gracias, doctor. Alina Diez.
We have Alina Diefter, who sent us the following question. How does PAHO assess the Uruguay case? And also, how do you explain the low number of cases and also to avoid cases of COVID-19? Dr. Alighieri. Thank you for that question regarding Uruguay. Uruguay is the only country in South America that has an incidence rate that has been decreasing over the last couple of weeks. From the very first cases in mid-March, Uruguay has reported 926 56 cases and 28 deaths. This is a low mortality rate. In this context, Uruguay has a system with lab surveillance that has been expanded with the use of PCR platforms as recommended by the Pan American Health Organization. Above all, they have implemented in a very early fashion public health measures such as social distancing, the shutdown of schools, and also the canceling of mass gatherings or events with mass gatherings. And they have also imposed very strong restrictions in connection with international travel. And all this was implemented in mid-March this year. I would say that to preserve those achievements, the secret lies with the gradual adjustments to be implemented to the public health measures in a context of contact tracing and detection, which is strong, and also expanded lab capacity with rapid response to any needs for research, all this within a context of a service platform for the primary care level. And this is a country that is well known for having a solid platform for health services. I would also like to take this opportunity to underscore an important aspect in the countries of the Southern Cone, and that is the recommendation to strengthen flu surveillance. This is the winter period in the Southern Cone countries, and this includes Uruguay. These are countries that are known for having significant outbreaks of the flu, and would also like to strengthen the importance of also having vaccination campaigns for influenza in addition to surveillance. Thank you very much. Thank you. Dr. Aldigueri. Now we have Jason Bouvier, who would like to ask a question live. Jason, can you hear us? Please, I'm giving you the floor.
I was just wondering, we're getting word that President Bolsonaro has tested positive for the virus in Brazil, and I'm wondering what your reaction to this and what it might say about the need for different approaches in Brazil in terms of strategies to contain the virus there.
Gracias, Jason. Doctor Espinal puede tomar esta pregunta.
Thank you, Jason. Dr. Espinal, could you please answer?
Yes, indeed. We've been hearing now, just a few minutes ago, that the president has tested positive for COVID. Is that if the case confirmed, PAHO would like to wish the president a speedy recovery, because we think this is important that everyone get a speedy recovery. But the message that this sends is that this virus is unpredictable. It doesn't respect race, colors, powerful people, or no matter the security around any president. If we remember what happened with the Prime Minister of the UK, the President of Honduras, there are cases already. But more important for Brazil, as you rightly point out, is the fact that the recommendations needs to continue to be implemented and strengthened. Social distance works, use of face mask, sanitation, hand washing, and the package of mitigation measures recommended by PAHO has shown that work. And in fact, I'm getting information that a study is coming out suggesting that many countries in Europe that implementing early lockdown when mortality was lower, they ended having a lower mortality than those that implemented lockdowns or mitigation measures later than those. So it is important that regardless of if the president is affected, the country continues strengthen the measures, and here is an example that we are not yet on controlling this virus completely, and we wish again the president a speedy recovery. Thank you very much.
Gracias, doctor. La siguiente pregunta nos
Thank you very much. The next question is by Lydia Lopez from La Prensa, Nicaragua. Lydia is asking several questions. One of them is, we have had 4 months of the pandemic in Nicaragua. What specific information you have in connection with the country? Dr. Ugarte. Thank you very much. The information that we received from Nicaragua has to do with the number of cases and deaths. And as you know, this is presented weekly. We have no detailed information in terms of the sex, the age, or the location of the individuals. It is important to have that information, and it is also important to have the result of the molecular tests that identify the presence of the virus. That is the only way that we can use to determine the spread of the virus and the location of the virus, and also for the population to implement additional measures in those locations. To that end, we also have information that the virus is present with community transmission. Therefore, social distancing and protection measures need to be immediately implemented throughout the country. We hope that the information on the locations, on the sites, can be spread to the population, because that is what the countries are doing to protect most of their population. Thank you. Thank you, doctor. And the next question is by Jennifer Reebok from Montserrat Guardian, and it reads,
reports of the US government supply of remdesivir running out at the end of the month. What can PAHO tell us about the current and anticipated availability of this drug in the Eastern Caribbean countries? Doctora Aldigueri.
Thank you for this question. We reviewed 3 randomized clinical trials, including remdesivir that were published recently. In one of the studies, there was evidence of reductions of the number of days of hospitalizations of severe cases. And in addition, the remdesivir is included in the WHO-sponsored Solidarity trial. We know from the media, like you, that the USA has purchased important quantities of remdesivir for its domestic use. So WHO and PAHO are now looking into the details of the exact nature of the contracts, but also you have to consider that they may be options for production of generic in medication in other countries. And the WHO is working on different fronts through the ACT accelerator to ramp up the production of different molecules that may help in managing severe and critical cases of COVID-19. Thank you.
Gracias, doctor. La próxima pregunta es de Rosa Bolaño.
Thank you, doctor. The next question is from Rosa Bolaño from Prensa Libre in Guatemala. It says, PAHO has disclosed 6 criteria to reach several objectives, including avoiding spread of coronavirus. These have been taken into account by other countries, but even so, they had to reclose their economies due to new outbreaks or surging cases. What new strategies can a country implement after seeing the experience in other countries? And what is your opinion or recommendations regarding what the country needs to do when the time comes to de-escalate in order to avoid a new disruption in their activities? Dr. Barbosa, could you answer this question, please? Yes, and thank you for this question. The first thing that countries must take, countries that are seeing a surge in cases, is to check and see how they can implement social distancing or make public health measures more effective to control spread. Without controlling spread, any kind of measure of de-escalating cases will result in a new increase in cases. So we have to make an effort to control spread. And to do so, it is very important to have reliable information, to have testing capabilities, because in many countries, the differences within the country are very significant. There are states or provinces where there's an increase in cases, whereas in some others, they seem to be under control. So basically, it's important to have high quality data to have a crystal clear picture of what's happening when transmission, what new cases are coming up, and trying to ramp up testing capability to its highest level to control spread. Now, once the spread is controlled, we can begin a well-planned process to carefully reopen the most essential sectors of the economy gradually, and as they reopen, they need to adopt biosecurity protocols that include hand washing, use of face masks in stores or offices or public transportation, etc. Also to, of course, keep social distancing between people. That is to say, all the necessary measures to be cautious and to monitor, because the countries that have gone through this process before Latin America, that is to say Europe, have shown that we will need to continue monitoring for several months, and we have to be extremely careful in order to prevent a situation that is under control to create a new rebound with an additional thousands of cases in deaths and sick people. Thank you, Doctor. Now a question from Grevic Alvarado from the Newsday newspaper in Trinidad and Tobago. And it says, the majority of the cases that we have seen in Trinidad and Tobago are from workers in different cruise lines. How can PAHO stop this type of spread since cruise lines are a huge section of tourism and source of employment in the Caribbean? Dr. Alieri, could you answer this question, please?
Yes, we are aware from the beginning of the pandemic, the cruise ships and cruise liners were a concern regarding importation of cases. And Dr. Dugarte during has also made some comments following a question from Bahamas regarding the importance of the application of very strict protocols regarding cruise ships and reopening airspace. The Pan American Health Organization has chaired during the last days with its country offices in the Caribbean consideration and recommendation regarding the non-essential travels to countries that at this moment have very low transmission risk. And also I'd like to flag again what and repeat what Dr. Ugarte said, is that it's important that countries that are reopening their airspace or maritime traffic monitor what is the situation in the countries of origin and have the option to adapt their list of countries allowed or not allowed to travel to their ports. And in the context of strengthening of the surveillance activities, including the contact tracing and including the laboratory platforms. This is, I think, a challenge that is shared by most of the Caribbean countries. Thank you.
Gracias, doctor.
Thank you, doctor. And the next question comes from Oscar Garcia from Prensa Libre in Guatemala. And it says, how can we face the pandemic in rural areas such as in Guatemala, where access to health is limited and, according to forecasts, transmission will increase in these areas? Dr. Ugarte, could you answer this question? Yes. Thank you very much. The main challenge is to be able to detect cases in time and provide access to healthcare services and diagnostic services as soon as possible. In that sense, we need to organize our healthcare services so that those rural populations that would normally have limited health services available to them could have a rapid response mechanism at the department or national level, and for the diagnosis to be given in a timely fashion. Also, we need to be respectful of their beliefs and cultural aspects of that sector of the population, and to reroute the response and tailor it to those sectors of the population. So, Guatemala's national plan and the national plan for all of the countries that face similar situations must include those sectors of the population as a priority in their response. Because in past epidemics, we have seen that that sector of the population gets much more affected compared to urban sectors of the population where they have more health services available. So early detection, access to health care services, accurate information so that the population can take the necessary action to prevent spread. And those are basically the main actions that should be implemented in those areas. Thank you. Thank you, doctor. And the next question comes from Cynthia Pineda from Red Más Noticias in Colombia. And it says, in Colombia's major cities, intensive care unit hospital beds is over 50%. What is PAHO's recommendation to prevent a collapse in our healthcare system? Dr. Espinal, could you answer this question, please? Yes, thank you, Sebastian and Cynthia. It is very important to have a hospital bed monitoring system. PAHO's recommendation is to permanently monitor occupancy rates. Normally, when we see an increase in bed occupancy rates, it's important for the country to plan accordingly and to talk with the private sector so that they can work collaboratively. Because if they need to resort to private sector beds, they need to be able to do it to cover their needs. And we believe that being in conversation with the private sector is extremely important because our country has a very significant private sector. So basically, to have a follow-up monitoring system and also monitor the recovery rate as well as positive rates, because those will give us an idea of how we can continue on and what's going to happen in the future. Let us remember that if positive rates are very high, 15, 18, 20%, the situation can be pretty delicate. So all of these are indicators, but basically coordination is key to ensure that all hospital beds in the country are indeed available. ICU hospital bed availability rates is a sign that the pandemic continues to increase and we must not let our guard down. Thank you, doctor. Our next question comes from Melia Ochoa from UNO TV in Mexico. One of the question is, people that have recovered from COVID-19, could they catch the disease again? And then after relaxing lockdown measures in Mexico, do you think there will be a new outbreak of coronavirus in our country? Dr. Barbosa, thank you for that question. COVID-19 is a new disease, and we are still trying to understand many of its aspects. And for that, we need time. For example, we don't know whether immunity after having the disease will last for 6 months, 1 year, 5 years, or 10, because nobody has had COVID in the past. So with the information we have to date, we can see that we don't see a new occurrence of the disease among people that have already had COVID-19. But we need to monitor that. The problem is that some countries had significant outbreaks, and the ones that were hit the hardest, such as Madrid, only 15 of the population was in contact with the virus. That is to say, 80% of the people had no contact with the virus, but they are susceptible to catching the disease. Mexico is monitoring the situation, the epidemiological situation in the states. And if that strategy is handled well and lockdown is lifting when transmission is controlled and is monitoring properly, and they continue to have things under control with widespread testing for all suspect cases, with monitoring ICU hospital bed occupancy rates, etc. If countries do that, then that's the way to go, because this is going to be our situation for the next few months. Now, if we stop lockdown or stay at home orders and cases continue to increase, more likely than not, we're going to have an even harsher rebound. So basically, we need to manage the situation according to the epidemiological reality of each state, because it's different. So the public health measures that are adopted must be based on the epidemiological data that is reflective of the situation in that particular area. Thank you, doctor. And the next question comes from Eliza George from the Observer Media in Antigua. And the question is,
who, once its borders reopened in June, recorded a spike in cases. Prior to border reopening, she says the country recorded only 26 cases. After the reopening, we have about 43 additional cases. Doctora Alighieri, ¿podría tomar esta pregunta?
Could you please answer this question, Dr. Alighieri?
Yes, thank you for this question from Antigua and Barbuda. That would cover also the same situation in Eastern Caribbean countries. We have been, the government of Antigua and Barbuda has reported to PAHO the increase of cases following repatriation flights, and with details, and with patients, including nationals and residents in Antigua and Barbuda. So I think that two other questions during this press conference have already answered part of this question regarding resuming air traffic after weeks or months of closure of airspace or maritime space. And the first principle that we have tried to highlight and is that countries should have a clear picture of the dynamics in countries of the dynamics of the pandemic, if countries of origin, and can modulate and adjust their travel recommendations regarding access to their countries. The second principle is really the need to work more and more on resilience of health services in order to be able to cope with an influx of patients regarding isolation capacities and also quarantine capacities, and an influx of severe patients in health services. And this together, all these measures are a package. You don't have a magic bullet. You need strengthening of laboratory surveillance, and Antigua Barbuda is a good example, because since the beginning of the pandemic, Antigua and Barbuda has developed and implemented the PCR diagnostic in the country, and that contact tracing teams are trained and equipped in the sense with software in order to do the contact tracing. This is the way that the country must prepare in the Eastern Caribbean and also in many other countries. Thank you.
Gracias, doctor. Y la próxima pregunta es de...
Thank you, doctor. The next question is from Jose Maria Costa from La Nación newspaper in Argentina via the chat room, and it says, today we had a peak in deaths in Argentina. Is there a way to predict what that growth is going to be like, the same way you do it with the infectious curve? And what strategy should we implement to see a drop in that increase? Dr. Barbosa, could you please answer this question? Yes, thank you. I believe that when you talk about a peak, you talk about an increase, because we talk about peaks once we started to see the decrease. And you can say this was the day when we saw the highest number of cases. So I believe that the question is because in Argentina, as well as in other countries in South America, like we said, with the exception of Uruguay, of course, they are all seeing an increase in cases. There's an increase in Argentina, in Chile, in Brazil, in Peru, Ecuador. That is the trend. And like we've said, we need to implement the measures that work and that works to keep Argentina under control. Argentina has a number of cases compared to its total population that is much lower than that in many other countries. The death rates are still kind of low, and Argentina needs to continue implementing those measures that worked. And we know this is a big challenge because of the economic and social situation in our in Latin American countries. Any countries that have to do with suspending economic activity impacts the population severely, especially those who work in the informal sector. But it's very important for the country to be able to maintain those measures and revise them as necessary to be effective. There's no other way. We have to work on prevention. Social distancing and other measures, if not implemented, transmission will continue to increase, and we will have a higher number of cases, of severe cases and deaths. So we need to look at what we can do in each country to make those measures effective. And also to make testing more widespread so that all suspect cases can be tested with PCR, have their contacts traced, and the countries that are, the people that are at risk have to be monitored more closely. So this is what we can do to control transmission, not only to flatten the curve, but also to keep the numbers low and lower each day. Thank you. Thank you, Dr. Barbosa. And the next question comes from Urania Molina from La Prensa newspaper in Panama. And it says, Panama has seen a surge in cases over the past few weeks. Is that good or bad? And we have seen between 900 and 1,000 new cases per day. Is that because of community transmission, and can that continue to grow, and up to what point? Dr. Espinal, could you answer this question? Thank you, Rania, for that question, which is very important. It is not bad to detect more cases, and finding new cases is not a bad thing. Quite the contrary, it is a good thing because it would allow us to have an idea of how the city or the location or the province or the state is doing. And that is why the Pan American Health Organization's recommendation is to increase diagnostic testing, because that allows us to have a clear picture and, more importantly, a potential intervention in any given location. Like you very well said, this is a result of community transmission, and Dr. Barbosa spoke before me about the fact that in other countries that is on the rise. Well, and the virus has to run its course, but measures need to continue to be in place. And the fact that countries are finding countries does not mean that they're doing things the wrong way. Quite the opposite. They are going to look for cases in order to focus on them and prevent deaths, because the earlier we take action, the quicker we will be able to prevent deaths and hospitalize those who are at risk. So it's important for testing to continue and for the mitigation measures to continue to be implemented in Panama and other countries in Central America and the region. Thank you very much. Thank you very much, Doctor. And with that, we are getting towards the end of this press briefing. And the final question we have received says,
after these past 6 months of COVID-19, what have been the main challenges that PAHO has seen in public health in the region? Doctora Etienne?
Thank you, Sebastian, and thanks for this question. Indeed, COVID-19 is challenging our public health in every level. Not only because many of our hospitals are already nearing maximum capacity due to COVID-19, but also because many other services have been indirectly affected by the pandemic. And this is a challenge that eventually could lead to major public health issues for our region. For example, regular vaccination services in some countries have recently been restarted, but many of these countries are reporting difficulties to access supplies and vaccines. Maternal mortality. In Latin America, this appears to be increasing for pregnancies associated with COVID-19, but also when not associated with COVID-19. And this is most likely related to either discontinuity of or irregular prenatal and postnatal services and difficulties accessing safe delivery services. The region has observed almost 60% decrease in reported cases of malaria. Now, this reduction does not mean that malaria suddenly is disappearing from the region, but rather it reflects that less people are seeking care due to lockdown or the inability to access effective care. With tuberculosis, for instance, countries have reported reducing frequency of outpatient visits to health facilities for treatment, for monitoring, and for even the collection of drugs. Services for the prevention and treatment of non-communicable diseases, or NCDs, these have been critically affected also since the pandemic. Services were interrupted in several countries, affecting all types of care for people with different NCDs, but more so for diabetes, hypertension, and rehabilitation services. Many of the health staff that work in this and other areas have been reassigned to COVID-19. And when we look at the impact on mental health, that has been significant, with increases, for example, in anxiety, depression, sleep problems. And more studies are now showing that the mental health impacts of COVID-19 on our healthcare workers is significant. The continuity of essential services provided at the first level of care has been especially affected in peri-urban and rural areas and among indigenous populations. This relates to the already existing deficit of health workers, along with social distancing measures, infected healthcare workers, and the closure of various primary care facilities in these areas. All of this demands or requires that we rethink the provision of health services in times of COVID-19. This pandemic, I'm afraid, is going to be with us for some time, and we cannot afford to place in jeopardy the health gains that we have made in this region. So with countries of the region, PAHO is working to find innovative ways to deliver effective, safe services to all the people. Thank you.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. And with that, we have reached the end of today's press briefing. Thank you very much for joining us and participating. And as usual, briefly, we will be sending Dr. Etienne's opening remarks as well as a recorded session. And you can continue to be in contact with us via email, and we will try to respond to your messages and inquiries as quickly as possible. Thank you, everyone, and we'll see you next Tuesday.